My throat is really sore. Where should I go to see the doctor? Should I go to urgent care? Should I go to the Minute Clinic? Should I go to the emergency room? Should I just schedule an appointment for my doctor tomorrow? In this episode of Healthcare Hacks, we're going to talk about where you should go from a financial perspective. Hi, my name's John. I'm your healthcare hacker. I am not a doctor. I just know money. So if you're sick, talk to a professional, but I want you to understand some of the financial impacts of those decisions of where you go. If you're really sick, you need to seek care right now, you go to the emergency room. That's a lot of times a very appropriate place to go. However, just realize that's the most expensive. You're going to end up paying, first off, a lot for the emergency room facilities, and then also the doctors are typically billing separately. So just by going to the emergency room, it's going to cost you several $1,000s. The next most expensive is urgent care. You've seen a lot of these pop up. They've got shorter hours. They don't see quite as critical condition type people. They usually have higher copays or higher cost than just going to your doctor's visit. You can always schedule an appointment with a doctor. Now, sometimes that's not feasible. If I got a sore throat, I don't want to wait a week to see my doctor. But in some areas where you can wait, that might make the most sense because then it'll be treated like a typical office visit and you can just pay your copay, your deductible, etc., which would probably be just a couple $100s. And finally, there's a Minute Clinic or some sort of retail clinic. These have been popping up in a lot of times in many retail stores around the country. These are cheap ways for simple tests. I've got 3 young kids. They get sore throats all the time, especially since school started. I don't want to go to the emergency room and wait 4 hours to see a doctor. So when they come home with a sore throat, a lot of times we'll just take them to a retail clinic just to do a swab to see if they got strep throat. It's a relatively easy way to seek care, and it's also the most cost effective. So I can't give you answers on where to go. I just want you to understand that there's big cost differences. You know, typically you're going to pay 2 to 3 times more for the emergency room than you are for urgent care. And urgent care, you can spend 2 or 3 times more than you're going to spend for your doctor's office. There's also the option of doing teledoc or nurse hotlines. A lot of employers have these programs that allow you, again, for simple things, to schedule a visit, very convenient to do over your computer or over the phone, to see if you need an antibiotic. A lot of times for strep throat, urinary tract infections, or just overall the flu and cold. They can get you that first level of care. Now, they may still send you to a doctor, but at least they can get the simple things taken care of. A lot of times for many employers, you don't pay anything for those visits, they're free. So take advantage of them if it makes sense for you. If you have questions about how to save money or problems you're facing with healthcare dollars, email us on the address on the screen.